You have time for questions. Thank you very much. If I could ask those of you who are standing, there are some seats over at the front here, so if you want to make your way forward while I gather some questions for Secretary of State, we'd much appreciate it. Thank you. So, gentleman there at the back with the purple tie. If you could say who you are, please.
Andrew Dougal, Northern Ireland, chest, heart and stroke. Could I ask the Secretary of State, how can we empower heroic leadership in non-executive directors, which I think is very important if we are going to have a health service which is accountable to the communities which they serve? And how can we avoid non-executive directors being servile to the executive directors, being servile to ministers and senior civil servants? Because in the past I'm told that some non-executive directors look over their shoulders before they speak out on behalf of the community because they're afraid of what the minister and the senior civil servants will say.
Thank you. I'm going to take 3 questions and then ask Secretary of State to respond. Here, Fiona, thank you.
Thank you, Michelle Drage, Chief Executive of London Wide Local Medical Committees, GPs, to everyone else. Integration, I think there's a view that says integration should be vertical, and certainly that's how it's being played out. And I think the concept of horizontal integration is much more familiar to GPs and to primary care teams. And I think when we're looking for the right way forward with integration, with or without competition, you know, we'll have our difference in opinion, but you're the legislator. At the end of the day, we're looking for the best for patients. However, I think we won't get the best for patients if we rely on the concept of vertical integration rather than horizontal integration. A concept which I think underpins your vision, and actually a concept which many GPs from the last generation were very familiar with during the 80s. And sometimes it's good to look back, to look forward. So I'd really ask you for your view on it. I suspect you might say, I don't care where it comes from as long as it is. But I want to flag up that concept and to have it aired. Thank you.
Nick, as a delegate, I've asked for journalists to give the opportunity to delegates to ask questions this morning.
Could I just ask, Nick Clegg?
I know you weren't here at the beginning.
Nick Clegg has just said that he won't accept an economic regulation that promotes competition and only one that supports collaboration and integration. Is that acceptable?
Sorry. Right, okay. Right, Andrew first. How can we empower non-executive directors? Well, actually, I mean, there's no simple answer to this, because actually it's partly about ensuring that the quality of non-executive board members is high. And, you know, I think actually in the NHS we have made significant improvements in recent years, but we have more to go. But then I think if you give people clarity about their accountability, that is very important. And you have to have a position where the members of governing bodies, boards, I mean, for Foundation Trust, for example, boards of directors, or in commissioning consortia, their governing bodies, you have to be very clear that they should have accountability in one direction and not several directions. So, particularly with Foundation Trust, for example, I think many boards of directors of Foundation Trust have had executive directors who are not completely clear about whether they succeed or fail, and whether they are thought to have succeeded or failed is something that is actually integral to the decision of their board, as distinct from a bureaucracy outside it. And people behave, frankly, mostly in rational ways. If they think their future is not determined by their board's view of their success as executive board members, they will not actually listen to the non-executives. They will listen to somebody outside their organisation. So we've actually got to focus organisations. It's part of why giving Foundation Trust, I think, clarity and autonomy and accountability, it is actually about making sure that the boards of Foundation Trust are very clear about their accountability to patients and for the outcomes they achieve, not to some external hierarchy of management that imposes alternative criteria upon them. Secondly, Michelle, Well, I mean, there are circumstances where vertical integration delivers significant benefits, clearly does. There are circumstances where horizontal integration delivers significant benefits. In both cases, there are circumstances where integration, if it leads to a situation where there is, as it were, abuses of competition, it will lead to detriment to patients. And it will disempower the commissioners from being able to secure the service that they need for patients. And the balance between those two things is absolutely at the heart of making this work. And from that point of view, it brings me to Nick's answer. The answer is very clear, actually. You know, because the bill doesn't change competition rules inside the NHS. It doesn't change them at all. We know in the NHS there are tasks like ensuring and protecting access to services for patients, making sure that the viability and the sustainability of organisations is protected, making sure that pricing, the development of the tariff gives us a level playing field and helps us to drive up quality, making sure that if there are abuses in terms of competition, people who are trying to prevent commissioners and patients getting the services they need, that steps are taken to prevent that happening. And the coalition agreement, we were absolutely clear about the desirability of Monitor taking a responsibility for those three functions. But it isn't about promoting, because the point that Nick is asking, well, what Nick is saying I think is absolutely right. We're all clear. We've got to have a level playing field. David Cameron said on Monday, and I've said today, and we've said many times together with Nick in the past, competition is a means to an end, not an end in itself. So to that extent, we're not creating a new authority with new powers in relation to competition to promote competition. We need to be very clear that we are trying to create in the NHS a means by which we can support the NHS using all of these tools, including competition, but in order to serve the interests of patients.
Time for just a couple more.
Yes, of course.
Good morning. I'm Dr. Alpha Sadhu, Medical Director at Ealing. In my day job, I am a consultant physician in care of the elderly, and clearly one of the messages I picked up from your talk was about the need for partnership, working and integration, which was music to my ear. The other message I also picked up from your talk was about the need for competition. And I find the two difficult to reconcile, and indeed when I get back to the office, and it has been my experience in the office, when we're looking for partnership, work and integration to provide care in the community, particularly for frail elderly people, the concept of the fact that we're acting anti-competition, competitively, becomes an issue. I wondered if you could square that circle for me.
Thank you. And lady over here.
Hi, my name is Lucy Howlett. I'm a graduate management trainee, and wanted to come on to your point about removing the two tiers of top management. And it feels to us, a lot of us, I think, that actually you're replacing those with the same people in different roles. The commissioning boards are going to have local, going to be spread, am I right? And also with the GP commissioners, it's not going to be just GPs that are going to be commissioning. They're going to need a lot of support, and it will be a lot of those managers who've been commissioning already that will be involved in that. And just on a separate issue with competition, as my colleague just said, one of the issues we've looked at is healthcare around the world. And when competition has been introduced in other health economies, it may have improved efficiency, but it has not driven up quality.
Thank you. And finally?
Yeah. Devinder Sandhu, I'm postgraduate dean of Severn Deanery. In a culture of austerity, education training budgets are always vulnerable. And we all have to sort of make our contribution and support the wider NHS. And I can accept top slices and things like that, but it's the constant changing of the budgets and destabilization that happens through the year that actually makes it very difficult to try and deliver the workforce for the future, and impacts on how efficient and effective you can be. So when you talk about reducing the bureaucracy, about creating efficiencies and effectiveness and the QUIP agenda, in the white paper it doesn't really address how education and training budgets will be supported.
Thank you.
Fine.
Secretary of State.
Yes, sir. Medical Director at Ealing. You had the Prime Minister with you on Monday, so I think he I think very well explained on Monday precisely these issues. That from our point of view, competition is a means to an end. So it comes to the question of, well, how do you reconcile integration and competition? Well, from my point of view, actually, it's integration you're looking for, and in exactly the same way as anybody in any other walk of life would do. You set out, you specify what standard you're looking, what quality you're looking for, and you look for the degree of integration that serves your needs and your needs of your patients. And I think we want to arrive at the point where competition, insofar as there are competition rules, and actually we're not changing the competition rules, public procurement rules, EU public procurement rules apply in the NHS. The point is we have in the NHS an organisation that should be clear about the character and the structure of the service that we're looking for. And then I think that drives it. And actually what you're describing at the moment, you see people are having this debate about whether we have competition in the NHS. It's happening now. It's happened for years. And actually it's happened in a way that has been fragmenting services, because it's been treated as the only way in which you can meet competition rules is to have a competitive tender. Well, actually, if we move to a situation where we have designed pathways of care, where we're clear that's the basis upon which we want to commission services, if we support that, for example, increasingly with tariffs that are based on those pathways of care, and if we move increasingly to any qualified provider, we can move to a place where whoever can meet those specifications and that price can deliver the service. And your commissioners can say, we would like you to be delivering that service, or they would like somebody else to be delivering that service to their patients, depending on their location and the choices that they make. But the point is, it doesn't then break up the service that you're offering. Whereas at the moment, very often, it is being broken up, because the only way to demonstrate you're actually meeting the competition rules is to have a tender process. So actually, I'm looking to a place where we have fewer of those kind of, win or lose kind of operations, many more relationships between patients exercising choice and providers offering a range of services. Okay, and I think that Lucy, I think it was I wasn't here, but I think you should have been here at the King's Fund maybe 2 or 3 weeks ago, because you had a number of people debating precisely these issues. And actually the evidence is very powerful that if you have, as we are intending to do, a structure that is increasingly based on price determined through tariffs, so that in effect there's benchmark prices and tariff prices, that the competition that you deliver is competition on quality. And actually the design we're looking for in the reforms and the modernisation is precisely built around the experience in a lot of places across the world that you can significantly improve quality by that kind of competition, and our own experience on the internal market in the early 1990s, that competition that was based without that kind of emphasis on quality and promotion of quality actually led to the diminution of quality because of the emphasis on price. So that's precisely why we're moving to this system, where it is actually about tariff-based prices enabling competition on quality. And I think the evidence is very strong. The reason why the white paper on equity and excellence and liberating the NHS didn't elaborate about education and training budgets is because, I was very clear, we've been very clear, we want the professions across the service and the providers of healthcare services to take greater ownership of the structure of education and training. I mean, there is something, frankly, absurd about a situation where some of the, 1 million of the best qualified professionals in Britain wait for the government to tell them what their professional standards and education and training requirements all have to look like, and it's only when the government agrees that they can do these things. Most other professions don't go down that path. They don't wait for the government to tell people what to do. There is something faintly absurd about thousands of organisations that have immense responsibilities for patient care, who frankly feel that they have no control over their own workforce planning, their own workforce development, ensuring they have the right workforce in the future. So we want to make a structure which brings those people together, brings the professions and the healthcare providers together to ensure that they collectively agree on workforce planning, development, education standards, training standards and numbers. So from my point of view, the reason that you're not able to respond to a set of the government's, this is what you're going to do, is because we haven't set that out. We're trying to do it the other way around, which is make this something that emerges from the consultation we launched at the end of last year on education and training. Now we're doing it in this listening exercise because actually people made the perfectly reasonable point that at the same time as we are clear about how the service can develop in the future, we want to see how the education and training support for that service develops as well. So hopefully at the end of the listening exercise we'll be able to respond to the consultation on education and training and the many points that have been made during the course of this listening programme. And in terms of budgets, I want stability if we possibly can. That's why I've made clear that the budget for education and training is the same in cash terms. Now, I have to say, in the context of the public services as a whole, keeping the education and training budget the same is actually very important. And I think in terms of many of the education providers and training providers, particularly in the higher and further education sphere, I think they actually need to understand, and we need to do more for them to understand that we, to that extent, are a source of stability in the system rather than a source of instability.
Thank you very much. I'm conscious there are many burning questions. But I'm also conscious